better services online.
Oh, we have sound. Welcome, everyone. Sorry about the technical difficulties. Do we have audio? Can people hear me? Give me a thumbs up. Okay, great. Don's at home. I'm going to be filling in his big shoes and chairing this afternoon. So welcome to the June 10th Health and Housing Task Force meeting. I'd like to recognize we're on the traditional territory of the Nanaimo First Nation, and we're grateful to live, work, and play here. Today's meeting of the Health and Housing Task Force will be held in accordance with the Community Charter, Council Procedure Bylaw 2018 number 7272, and Ministerial Order number M139. Therefore, members of the public are required to observe meetings virtually and not attend in person. Question period is suspended throughout the duration of this order. Members will attend via Zoom, maintaining physical distancing at all times. Members of staff that are partaking in the meeting will be spread out in the boardroom. So, introduction of late items.
So, thank you, Madam Chair. Just a motion to reorder the agenda to consider Dr. Turner's items B, C, and D prior to item A.
Okay, do we have a mover for that? Dawn and a seconder. I think I saw John's hand. Okay, so then adoption of the agenda as is. Dawn, do you want to adopt the agenda? And Signe? And we have some minutes. To anyone, I'm guessing everyone had a chance to read. Are there any questions or revisions from the last minutes together? Okay, if we could have a motion to adopt them then. Dawn and Jason? Okay, and that leads us into the meat of our meeting, and we have, I believe, Dr. Turner on the phone with us, do we?
Yep.
Thank you, Karen.
Sorry, I just wanted to find out, we are recording these meetings, so perhaps we could get the people who have their phone numbers that are showing to just let us know their names, and then we will amend it. So the person with the phone number 8285, can you just let us know who that is?
Sydney.
Okay. We'll just rename. And the person with the phone number 8500.
Lisa, probably mine, Island Health.
Thank you.
Thanks, Lisa.
And I need to drop off for about 20 minutes at 3:30 and then I'll be back.
Okay, great, thank you. And we have a couple of people in the waiting room. Let's let them in before we do our magic. Is everyone loving the Zoom meeting? Aren't they amazing, you guys? Cam, I heard you were coffee deficient. If you came in, I would have brought you one. Okay, I think we've got everyone.
Here's Dr. Turner.
Hi, Alina.
Hi.
Okay, so we've gone through all of the kind of businessy that we need to do. So, Alina, you are up. We've passed over our first report, and now we're on to integrated needs assessment. So Lisa's going to do an intro.
I don't think I need to do too much of an introduction, but Alina's going to do, in sequence, 3 presentations. One on the integrated needs assessment that we heard some information about at our last meeting on the 25th. Then she's going to talk to us about ecosystem design, which is basically how could we reorganize the current system and way we're doing things. And then she's going to talk about something that I'm particularly interested in, which is integrated coordinated access. So again, how we look at changing our system and working together in a different way across sectors of health and housing, from non-profit to local government and other entities. So with that, we'll hand over to Dr. Alina Turner.
Great. Hopefully everybody can hear me as I'm going to start sharing my screen. Oops, that's not the right button. There we go. Awesome. So hopefully you guys can see my screen, right? Sure. Thinking. There we go. Okay, and thanks, Lisa. That was perfect intro. So I had a couple of things to run you guys through today.
starting with a bit of an update on the needs assessment. So thanks everybody for giving us your feedback. So my team's periodically updating everything with some new data that's come in from BC Housing. We've got some shelter data that I was really happy about when I saw, because it confirmed that the assumptions that we made in the modeling that we presented to you were actually pretty bang on in terms of demand. So that was good. I was really, really worried about that I was making big leaps without data, but after you do this a couple of hundred times, you kind of get the hang of how to make the assumptions. So I was really happy to see we were on track and didn't present you things that didn't line up with what BC Housing was seeing as well in terms of numbers. So that was good piece of news. I believe there's a couple of letters as well that the team wanted to get out from the task force that we discussed at the last working group session in terms of building a data sharing pipeline to the task force that was more ongoing, particularly around the investment in various services as well. So I don't know, Lisa, if you're comfortable with me bouncing that back to you. It's just something we talked about at the working group session, and we had drafted the letters, but I'm not sure if there's anything beyond that you wanted to share on this item.
No, I don't know if there's anything, Erin.
I haven't seen the letters. I recall the conversation about them, but I haven't seen drafts.
Yeah, I'm not sure. I don't know if I missed an email there, Lena.
Okay, that's okay. Well, we'll send them on again. They were sent the day after our working group meeting last week, but again, so no problem. We'll get those to you guys. But in terms of for the task force, at the last working group session, we chatted about creating some letters just to be really, really clear about our data ask
Yes.
to BC Housing and Island Health. So my team drafted it just because we know what we're looking for, and then we had thought a good thing might be to have them come from the task force, just because there's, you're all well informed about what that request looks like to these member bodies as well. So we'll make sure that if you guys didn't get it, Lisa, we'll just get them to you ASAP, and the working group can review next weekend, bring it forward after.
Alina, I was thinking about another letter going to the government.
Okay.
So yeah, you're right, and thank you for doing that. So for context for the task force, in order for Dr. Tuna to really give us good results, there was some really specific data that she's looking for, and we realized that asking task force members to comment on the integrated needs assessment, that oftentimes you're having to go to your research departments. And so Alina and her team felt it would be clearer to provide a clear letter outlining what's needed, so that when the request is forwarded, it's that much easier for a researcher or whoever's tasked with getting that data on behalf of you to go through. So yeah, thank you for that, Alina.
Yeah, no problem. I know lots of letters right now, for sure, from everybody. Great. And then, we'll dive into the next piece. And so exactly what was said from Lisa's introduction, we had a working group session last week that dove into kind of emerging areas that were quite I don't want to say common, but seem to come up over and over again in the design labs, as well as our research, and in conversations with all of you through the last number of months. So what we said was, let's start articulating what these various roles are or functions in the ecosystem design, and then rather than putting cart before horse, let's start fleshing these out, and then start to visualize them so that we can plug in the various players into the buckets of work rather than the other way around. So a couple of the things that we talked about, and there's obviously a lot more meat behind all of this than is presented here, but just to give you a sample of where we're going in the working group. So systems planning, integration, innovation, so that the concept of the infrastructure that's going to coordinate the ecosystem, and we talked about that as the backbone. Oftentimes that backbone organization comes up a lot, that needs to straddle the various ecosystem buckets of action happening, the various funders. How is this all being coordinated at a high level? So that's one of the buckets of work that's going to likely show a prioritization in our recommendations from this work. Another one that's come up quite a bit is data collection, sharing, and analysis. And these letters that we talked about before, this whole exercise of the social impact audit, it's really about that data sharing infrastructure to help us have as real-time information, actionable information as possible on a go-forward basis. Some of the examples, and these are just examples, doesn't mean we're going to land on this, but the kinds of things that have emerged is, the concept of HIFIS, or an information management system. It doesn't have to be HIFIS. HIFIS is a branding product, but it's required by certain levels of government. So if it's not HIFIS throughout the ecosystem, which is very unlikely given the various privacy legislation and just business needs of the various operators, then we're going to need to think about data interoperability and data sharing and mechanisms so that the service providers, the 600 service providers that are in the ecosystem, can actually have the access to the right information at the right time to give the best service. And then from the client perspective, that user journey is not burdensome from a data and information sharing perspective, but still gives the end user as much control as they need and deserve as well. We talked about the concept of data bridges and how do you get the funders to share timely information so that it assists that higher level coordination and systems planning that we wanted to achieve. And then we got into service planning, coordination, continuous improvement as another bucket of work. So how do we actually leverage some of the work that's happening on the homelessness side? For instance, around CAA refers to coordinated access and assessment. It's the idea that you have a consistent triage and placement process for people experiencing homelessness. And then we got talking about that's really part of the ecosystem, an important part. But homelessness, from what we heard in the needs assessment consultations, in the various conversation with all of you, as well as the research and best practices in other communities, is that coordinated access is not something that should only be thought about for one population, that it's something that we need to think about across the ecosystem. So we discussed quite a bit this concept of integrated coordinated access, and I'll show you a bit more about what we mean, because we really went down this path. And the team that was the working group had a much more fulsome discussion that I'll summarize for you today as well. And we'll get into that. And then the other bucket is investment planning and coordination. So again, you've heard this quite a bit, that there's significant funds in the ecosystem. We now know what the gaps are in terms of program models and housing models. We also know a little bit about how much funding is invested in broad-based speaking. We have some gaps in our knowledge in terms of how it breaks down at the funding stream level. And the reason why that's important is because it's obviously really hard to shift a system and how a system operates if you don't even understand the financial flows and accountabilities and contracted expectations in these various 600 services that are part of this scope, especially because we're talking health and housing. So that's some of the work that we still need to dig into further, and that's where all this talk about social impact audits is so important. I'll give you a bit of an insight, and I'm part of an effort in Moncton and New Brunswick around funding coordination that made me reflect on the process that we might want to consider too as we go forward. What they're doing there is that city council So the mayor and city manager are the ones that are socializing the concepts at the ministerial level with the key kind of health, social services, and the premier's office, so that there's a partnership that happens between the province and the municipality around funding coordination at the really, really high level. So the political representative's role becomes really important from an advocacy perspective, because they're talking the same language. Everybody wants return on investment. Everybody wants better outcomes, and the same as you, they have very similar challenges. And I don't know if Jake's in the room. He knows the city manager there as well, and there's some interesting parallels between Moncton and Nanaimo, besides being on opposite coastlines. So I thought it was an interesting approach that they want to take in, having obviously the administration level engagement around data sharing that we're doing, but then having this additional political socialization strategy at the provincial level to get that high level sponsorship for the work. Now they're obviously early on in the process, but it's the one that we should keep an eye out on and see how they fare in their jurisdiction. So that's a bit of that. In terms of the ecosystem design update, this is a draft that we had constructed early as a first cut on, and we took it to the working group and said, are we on the right track with some of our thinking about visualizing the ecosystem? And again, the whole point was, can we create something that's easy to understand in terms of what we're trying to achieve, that gets to the point that we're trying to create an ecosystem that incorporates 600 service providers, multiple funding streams in terms of sectors and government departments, et cetera, and et cetera, et cetera. So as you can see here, they came up with like some, they're saying, we really want to show that it's integrated, not so parceled out, and what the feedback was to us was seems like we're just trying to connect the dots between still a fragmented system. So that was kind of the takeaway, is we need to kind of do some more work around the ecosystem design, and my team has kind of taken that feedback and kind of developed a next level in terms of visualizing this work. So, we talked about having a solid look at or a solid understanding that there's various levels of needs and profiles of issues, and here's kind of the various issues. You can see health and housing, addiction, violence, etc. But this whole concept that we have an integrated approach through and process through which people connect to the right services, and that these services include the housing continuum, so the actual bricks and mortar, emergency shelter, home ownership, assisted housing, living, etc., and then the various support options that might be needed there. And then there's a way through which we can connect all of these between the coordination of services, so the actual day-to-day operations, how our services connected to each other through workflows, through technology, through policies and procedures, and then of course at the higher level, what the integration is from a funding perspective and investment perspective in all of this. With these kind of 5 pillars that we talked about before, kind of the grounding within it. So that's, a little overview of the progression of thinking. This is the reason why this is important, of course, is because it tells us a lot about what's in scope and what's out of scope in terms of your strategy, because we're now getting into what are the buckets of recommendations, what are the actual actions actionable implementation next steps that you need to be taking. And we're building the plan as we fly it because we haven't, as you recall, we're meant to go back to community once COVID restrictions are fully lifted for the second round of design labs. So normally all the design labs would have happened and then we would have done this. But what we said is we didn't want to stop the work. As you can tell, we tried to do as much as we could during the lockdown, if you will. And then what we'll then do is use the next set of design labs to actually test out these concepts and get validation, so kind of splitting the flow a little bit, but still keeping you on track so that the task force is not kind of sitting on things for a year planning versus actually getting to recommendations as soon as possible. So maybe I'll pause here before we talk about integrated coordinated access in more detail. Is there any thoughts on this, or those of you that are part of the working group, did you want to chime in on anything at this point?
So I can't see the screen, so folks just jump in if you have questions or comments. Go ahead, Lisa.
Thank you, Lena. It's I'm glad to see the spider web go to the other. Sorry, I didn't know how else to frame it. One of the questions I have, and I'm sorry I didn't raise this previously in the working group, is the thoughts around, instead of a housing continuum, thinking of housing and supports or housing and health spectrum and that kind of language. So we look at it. I'm just wondering what your thoughts are. You might have seen that terminology used, and why the spectrum versus the continuum. If that makes a difference in how we think about things. That's a good distinction. You're absolutely right, because continuum implies progression, right? Like that there's a stepped approach, and that's certainly not the intent. So I think you're right. That spectrum might exactly get at the fact that you might have high intensity supports today and low intensity tomorrow, and be in assisted living today, and so it's the right tool for the job rather than a kind of stepped A, B, C, D progression. Is that kind of what you're getting at too, Lisa? That's right.
Yeah.
Thinking of somebody who may never progress shelter to homeownership, but may go into long-term or assisted living and that form of housing, and how that, if we think of it beyond the scope of BC Housing's form of housing, but the Island Health, integrated forms of housing that come, whether it's long-term care or assisted living, how that fits in the spectrum. And some people, that's only where they're ever going to be is in long-term care. They're not going to be able to move in or out of that.
Just making a note of that.
It's Lisa. This might be helpful. I think that's what you're saying, Lisa Volpelting, is that long-term care is a residence for people, but we would never want to consider it housing. It's a very different part of the continuum. So. Yeah. I like that. The spectrum versus the continuum. Yeah. That's good, and I know for some of you that are like, we're talking about this, it's because if you don't get this stuff right, it then crops up later on in your implementation, and it rears its ugly head when we're actually not on the same page on some of these really foundational bits. So I appreciate everybody's patience for it. The other thing I was going to show you guys from Kim, our designer, where is it? There it is. So she was saying, because she says she's a regular person that uses the system, and she has no idea what we're talking about half the time. So that's often a good good people to check in with. And she said, here's how I I understand what you guys are talking about, and she joined us at our working group session last week, and she said that I like it. We keep saying ecology and ecosystem, and she played on the Nanaimo waves, etc. And she said, I look at it as this person that needs support, which is the person kind of, fishing for support, and they're trying to catch the fish, obviously. And the support options are, the various wildlife here. The service providers are kind of the big fish, if you will, and you can imagine how the big fish have the little fish around them that kind of live within the ecosystem. And then the issues are the kind of we can see the pollution here, like the problems, like when you're fishing and you're getting more problems, and etc. So this is how she understands it, as somebody that's the common person. And then she talks about plungers as kind of being the food of the ecosystem, the kind of the plants within the ecosystem. So she said, by all means, use your guys' spider web, but when you talk to folks that have more of the lived experience and might be not as familiar with what you guys are talking about, it might be interesting to use these other tools to kind of get people thinking about what we're trying to convey here. So that's another thing I was going to show you guys today.
Alina, it's a great tool, and I think it will really help us in communicating out to the public. Like we talked at the working group, we seem to have this challenge with people not really knowing what the task force is doing, and our typical channels of posting on the website and yada yada aren't reaching the people we want to reach. But something like this, I can see being it's very digestible. I like it.
Yeah, cool. Yeah, that's what I thought. Again, we'll feed that back to the comms team, and the working group will massage this stuff further. But thinking about the different audience, the policymakers versus the common folks, and we can test this out in the design lab too to see if this is a good analogy or there's better ways of portraying what we're trying to accomplish. Awesome. So for the rest of my time with you, I wanted to give you a bit of an overview of our of integrated coordinated access in more detail, just because this was a major, number one, it's a major deliverable for our project with you guys to give you some key directions around the model for Nanaimo, but also to kind of bring up the knowledge in the room in terms of what else is happening across the country in this space, so that everybody's on the same page and kind of learn from your peers in other parts of Canada. So the big things in terms of integrated coordinated access and what it basically is, just like I said, an integration, the integration at the frontline level of how people get access to services in the simplest terms possible. The big difference between it and other types of approaches is it's not just one sector or one population, it's the social ecosystem as a whole that is within that scope. So as you can see here, this is a model from Grand Prairie. This includes things like early childhood parenting or food centers, recreation, mental health prevention services. And they divided into different tiers. So tier A are things that are really easily accessible, that are primary prevention, mostly, right, that don't require a huge amount of eligibility criteria, that they're not, you don't need a big acuity assessment. They're obviously early childhood parenting, you need to be a parent for, so it's not like it's a free-for-all, but, it's a pretty low threshold in terms of eligibility, and it's low intensity in terms of the actual service itself. So you can probably imagine what's in here from the Nanaimo landscape. Tier B services, these are, they're usually higher intensity. They're targeting folks that might be more on that secondary prevention level in terms of needs. So you can see here some samples of Tier B services. This is by no means everything. So just examples. Then Tier C, it's again kind of higher highest intensity, if you will, in the spectrum. So it'll have things like permanent sports housing, ACT model, assertive community treatment. It might have like that addiction treatment service that's within hospital or inpatient, etc. So it's what they're trying to do in Grand Prairie, and they have about 600 services too, so I thought this was a good one to think about, is to start kind of sorting through their map, their systems map, and starting to try to sort, okay, what's tier A, what's tier B, what's tier C, because then once you do that, you can start thinking about, well, okay, who's more likely to access tier A, and how would they do that? That's obviously a very different pathway versus tier C. So that's kind of what they then conceptualized as the next step. They said, okay, well, and this is one person, but obviously it just means people in general. They said, okay, and they did design labs to figure this out. So somebody that's kind of a lower need, that would be the target client for tier A services. Tier A services are, usually people that can access services online, so they can have a digital platform. So that's what they ended up using. At first, they wanted to create like a separate digital website, and then they ended up going with Health Seekers, so that's how we got to know them, is through being the digital navigator online. And then what they've asked us to do is, they said, well, oftentimes people don't even know how to, 600 services, that's a lot. Like, how do I even know what I could be tapping into? How do I know how to make my life better, essentially, if I wanted to navigate myself? So what they asked us to do is develop a well-being screener that sits on top of Health Seeker, that is a five-item questionnaire that then says, okay, you kind of, on basic needs, you're not doing so hot. Here's a bunch of things within your community you should be thinking about. You should be thinking about food, you should be thinking about income assistance, et cetera, et cetera. So then it's just that initial screener versus an acuity assessment. An acuity assessment happens in tier B, tier C type services, but this is like 2 minutes and something they can do themselves online. So that's how that navigation pathway is conceptualized. Obviously, people get into services a whole bunch of ways, but the research in Grand Prairie has shown that most people in this low need category go online and they're able to navigate it themselves or with the help of friends and family mostly. So their natural support is how they tend to find out about services. The folks that have more moderate, higher needs, they tend to be connected somehow to some providers. So they're usually connected through food security programs, through income assistance programs, social housing, etc. So for those folks, their recommendation from the user perspective, they said go to fish where the fish are. There's a fish analogy for you. So they talked about having trained systems navigators, so people who know how to navigate the system and have consistent process to making referrals and intake to these services at known community locations. So they've chosen libraries, schools, food banks, and shelters as their community locations for system navigators. And the system navigators are folks that in the libraries, it's people that already work in the libraries, for instance. In schools, it's actually the school resource folks, shelter workers, so it's actually using the existing infrastructures and when those guys got together and provide the PCN, the primary care networks as well, so the family doctors as well. They said, we already do this, we just don't do it very well, and we don't know about each other across these community locations. So what they said is, we want your help to develop a training curriculum and tools for us to be better navigators and for us to actually be speaking the same language, to have the same song sheet. So for them, their solution was to work on training module for system navigators, and to have different levels of system navigation. So level 1 versus level 3. Level 3 would be like an expert navigator. And then the last one, this is probably the one that's going to be most akin to what the homeless sector does for coordinated access and assessment. So for them, they have the health system, their health services there, their justice, police, like corrections, police, education system, child intervention, and homelessness as well. So they have these various systems that said, you know what, it's not just about homelessness. I have high system users of police services, or I have folks that are constantly going through remand center. And then there's this whole idea of, you know, how many of your high users are my high users. So this sharing of data, which again, I'll show you more about that in a second. So what they did is they said it doesn't make sense to have a homelessness one and a child youth at risk one, and with this, it's a city of only 100,000 people catchment area. So it doesn't make sense to have 20 tables and talk about the same families. Can we actually have an integrated service table where we talk about these complex cases and develop integrated service plans together? So again, hold that thought, because I'll show you more about how some of this stuff works in practice. So then it kind of hits everybody's to-do list or priorities in an integrated fashion, and it allows them to look at data holistically and serve the client holistically as well. So any questions about this? I know it's lots, but I hope it kind of makes sense what they're trying to do.
Alina, it's Erin. I have a question about the mid to high need.
Yeah.
So you mentioned that those folks are working already in library systems or schools.
Yeah.
That seems wonderful, and I'm curious how Grande Prairie made that leap in asking those folks to now bring in a new way of, like, they're essentially doing a different job than they were hired to do.
Yeah.
Like if you could just walk me through how they did that.
Sure. Well, they had, it's the whole thing from concept to implementation. So they're about a year into this versus, and so it's a good time to be asking this, because it tells you a little bit about how you would implement something like this. But what they did is they had a design process, a systems design process that engaged all these players that I'm mentioning to say, hey, you know, what issues are you seeing? Here's some stuff that we could be thinking about differently, and they're the ones who came up with this model locally. And what the libraries folks said is, man, we sure get a lot of social issues through the door, and it would be great if we could help, because, you know, libraries are in the business of information. So they're the ones who actually saw the opportunity. Is that the head librarians are the ones that are saying to the group, like, we can help, or we have a role. We're the ones that are seeing these challenges. The libraries are sometimes the only places where high needs folks know to go or are comfortable going, etc. So that's a common thing in different communities. But what I liked about this model is that the librarians are like, this is my work. So it's actually the reception, you know, the guys that are at the front desk and things like that, they're trained in health speaker, they're trained in system navigation, so and even like conflict de-escalation and things like that. So it's just embedded in their process. And there's a library in every town, so it's a natural place of gathering, and it's a neutral space and a safe space oftentimes, and it's non-stigmatized. So it's not like you're going to the food bank or you're going to the shelter. There's a stigma to that. That might be okay for some populations, but it's not probably okay for the person that's still trying to maintain that I'm okay kind of image. So that was their lead. They actually were the ones that came up with it. In other communities, it's the physicians who say, I see a lot of people that ask for social support through my practice as a primary care, provider, and I wish I could do my job better, but I don't have a clue where to send people. So again, same thing. How do we get this information, the training modules, and the social prescribing concept is really taking root in other countries as well. So I think physicians are also, not all of them, but certainly primary care in Alberta is seeing the value of doing this work differently. So in one community, Whiteport, it's more a regional, more rural area in Alberta. They're engaging their primary care physicians to act as like those librarians. So when your primary care physician goes through your annual checkup, they probably ask you about things like domestic violence and mental health, but they probably don't know that there's 600 services that you could benefit from. So how do we get them armed with this information? So it's leveraging things that are already happening with willing natural navigators where people already go anyway, where the lead to social well-being is not that crazy, because in libraries it makes sense, and primary care makes sense, and then the last one is the education system that I'll talk about, because that's a same thing. In talking to the school boards, Medicine Hat is one where we have 2 school boards that are part of innovation work in this space, and they said to us that half of their work is now social work. It's not education per se. And same thing, the teachers don't know how to navigate social services because it's so fragmented and unclear. Yet they're the ones that are seeing those families on an ongoing basis. So it's back to the fishing thing. It's fish where the fish are, because when we ask the end users, these guys, in all of these areas, where do they naturally go? Number one is friends and family. Okay, how do we get friends and family armed? 2, it's my physician, my teacher, my employer, my coach, my faith leader. That's where they go. So it's very few that end up going to kind of our typical charity nonprofit that, like, when you actually do a population study, and I think we talked about this, and say, where do you go for help and how do you access it? Majority of them don't go to the kind of formal social service system. They go to their natural supports and then these other kind of community-based supports first. So rather than streaming them all to an already taxed nonprofit sector, let's arm through preventative measures and more kind of, as much as we can, leverage digital to streamline that process. Does that help, Erin?
It does, thanks. That was really fulsome. We have a question from Superintendent Miller.
Cool. Yeah.
Yeah, thanks, Dr. Turner. Just a quick question. So what is the homeless population count within Grand Prairie, and is that a consistent count? Because one of the things we deal with here in Nanaimo is we have a homeless population 365 through our climate. I understand a lot of the prairie climates do not have homelessness in the winter. It's difficult to be homeless in -40. I'm just wondering if you've had any comments on that.
Yeah, for sure. So I actually liken you guys' homeless patterns to more akin to what I see in Lethbridge, because exactly what you're saying. Grand Prairie it's very much a kind of an oil and gas dependent town. So there's also like work seasonality to their pattern. So it's not as it's not going to be a big deal for them to eliminate homelessness. It's not that complex there. Not to say it's not going to be a feat. It's just the numbers are not as crazy. So this is a good segue into this, because this is the Lethbridge list of high system users. And as superintendent, you'll appreciate this. LPS, Lethbridge Police Service. So they, everybody that's in here, so LPS, supervised consumption, INTALK, the shelter, DOT is their outreach on the streets, mental health teams through CMHA, jail, EMS, community paramedics, and hospitals. So you can see here all those systems are represented. And what happens is, this is their unique ID. They all have sharing permission so that they can all talk about clients, and the clients give permission. So you can see here here, some have consent, some don't have consent, which means that there's certain things that can be talked about. You can see here who makes the submission, and then there's a kind of a formula to put them at the top of the list or not. So in Lethbridge, their homeless population is very much kind of what is estimated for you guys too. So they're at about 1,000 to 1,400 in the year, which is similar to what we see in Nanaimo. And I think their population catchment is similar to yours too. There's obviously it's Alberta versus BC, so it's not exactly the same, but the complexity of the needs is similar, and some of the public intoxication issues, that the social disorder challenges that you have are very similar to theirs. So anyway, my point here is that back to this this integrated service table, Lethbridge has one as well. They call it something different, but same idea. So this is how they work, right? So at every meeting they bring up this list, and then they develop a service delivery plan, and they house people off the list. So for them, they have 150 people that fit this high need. Like they're like the super users of the system, and that's how they. This is just a snapshot, but you can imagine there's a lot more people on the list. But they go through and they look at this and they say, oh, interesting. They're high supervised consumption users, so this is sorted on SDS. They're not necessarily DOT users. They don't necessarily go into INTOX. So anyways, they kind of cross-reference things like this, and they determine what the right strategy and who's going to be the lead. So this is the list of 150. They've housed 100. So during COVID. So back to my point about not waiting. Like this is done with the current funding envelope. So there is a way to do it, and the way that they've done this work is they said social services will do the housing and kind of psychosocial support, and that's funded through the BC Housing Equivalent and some Reaching Home funding, and then the health, because you can imagine huge addictions, huge mental health, that's done through their health system. So they've created this process where they partner on the delivery, and then police has a huge role to play because sometimes they're the backup to the case managers. The police is also the boots on the ground, literally. And so if they know that there's a process for these high system users, they're represented at this table, they can actually kind of solution together and see progress, right? Because that's the biggest. It is the biggest thing for the end user of the system and for the partners, because it's so frustrating when you're just spinning your wheels all the time. And you can track the numbers, and you can see the numbers go down. Like I said, some of these guys have, within 2 months, their system use decreased 80% in some of the cases already. So it's incredible what you can do when you partner and you do your work in a collaborative way. So I just wanted to mention that would be part of this work but you don't want to just only focus on that, is my point, because if you're only focusing on the high system users and you forget about the rest of the system, the ecosystem, then you're going to keep bailing out this leaky boat. And yeah, back to the fishing analogy. I think it's actually working for us.
Alina?
Yeah, so any thoughts on that? I know I'm running out of time, so.
Alina, quick question. So in terms of the by name list, one of the things that we've heard repeatedly is concerns about sharing data. So obviously other communities have managed to get all their partners at the table to share this list. And we know that I think several people have parts of this list or mandate to collect this information. So how did other communities get past this to quickly share it and start coordinating? Because this is critical to share.
Yeah. how did they do it? They had really strong leadership and buy-in from the kind of the police chief, kind of the mental health and addictions like lead person locally, PCN, the primary care lead. So it's kind of top level leadership, because the front line tells you all the time that things are broken and fragmented and we need to do things differently. But that's not where the hiccups are. It's usually within kind of middle management. So yeah, if you have examples of how it's done and that it proves to be beneficial to the end users, and you have case studies, and you start with 5, like Lethbridge started with 5, and it was called a 5 end user, 5 people blitz or something, like it was a blitz. And then they said, well, it worked with 5, let's go for 100. And then COVID hit, and it was really important to go for 100, and I think they're going for more than that now. The other thing that they did is they partnered with Indigenous leadership too. So the Blood Tribe Department of Health was a really big advocate, because there was so much kind of back and forth between, they border each other just like you guys. So it was a partnership that achieved this, and there's I forget the name of the collaborative on reserve. There's a collaborative on reserve, and then there's a collaborative in the city, and they actually are kind of integrated as well, so that there's a spectrum, not a continuum, but there's a spectrum of support between those two jurisdictions. And then the other thing that they're working on that's really interesting is permanent supportive housing, and doing a co-investment model between the Indigenous community being the kind of the primary in permanent supportive housing, so by Indigenous for Indigenous, because again here, like, we're talking about like 90% Indigenous when you talk about this complex needs population. So seeing the funders actually back off and saying, no, we're going to invest in Indigenous capacity building, and we're going to do business differently by, instead of kind of giving it to the most efficient or the usual suspect, they made the decision to not do it that way. So they created a permanent supportive housing consortium that is, the linchpin of it is the Blackfoot organization that provides services that typically doesn't do permanent supportive housing, and then it's building their capacity to become the permanent supportive housing operator, using social enterprise models and all those kinds of things. So there's lots you can do when you have leadership that wants to make that difference. So it comes down to that.
Okay, so I'm going to jump in again and say, at this table, through the chair, we do have a lot of leaders who are key to helping us get there. So.
Yeah, I'm kind of curious, from some of those leaders, Lisa, I don't mean to put you on the spot, but from an Island Health perspective, looking at the data that's available on screen, is this something that currently you would be supported in participating in terms of the sharing of information that we're looking at right now? Numbers of visits, etc.? Oh,
did Lisa have to jump off the call?
Oh, we lost Lisa.
She might be coming back though.
Okay, well, Don, we just passed you your hand. Was that? Go ahead. Just jump in, guys.
Thank you. Back on the same question. How did you go about obtaining consent, or how did they go about obtaining consent? Was it just a question as whenever you bumped into somebody, you asked the question, hey, can you sign this form, and we can help you out with more?
Basically, yeah, basically. And it's a standard form, so there's a data sharing agreement between all the partners, so they're going to be working like this. And then there's this thing that says ICA consent. Oops, I don't know. Yeah, no, yes, no, yes. That's when they actually go on the street. So the person who's making the referral, so you can see they're submitted by Arches. That means Arches has a relationship, like clearly knows this person if they are going to recommend them at this table. So then they go in and get the permission to share their information for the purposes of service integration and whatever service matching. And so they get the permission from the client to then discuss them at the table. So that's right.
And is it specifically only at the table and in amongst this group, the forum itself?
I mean, once once they get assigned a case manager, so this table, I want to make sure it's clear too that this table's purpose is to triage to the right case management, and then they would go through a case management process where they would do additional permissions as needed as their service plan requires. Yeah. And I'm super sorry, you guys. I have my call with actually Government of BC next to tell them about some of our great work, including you guys. So I'm unfortunately going to have to sign off, but I'm sure I'm on it. Yeah. So hopefully this helps, and I'm sure I'll be back to keep chatting with you guys as we progress in this direction.
Thanks, Alina. I really appreciate it.
No problem. Thanks, guys.
So, just because Dr. Turner is heading out, we can still discuss this. Does anyone have any remaining questions? Jason, I'm actually kind of curious for your perspective of the by name list and how building it is going, and if there's any support you need, any challenges you anticipate that we could help you problem solve.
At this moment, we're more focused on the more triage and assessment of individuals for the limited COVID responses that we've been able, or beds that we've been able to secure. So we haven't moved as far as by name list, but we are working numerous agencies through the coalition to create a process, including working with both BC Housing and Island Health. So making small but meaningful steps leading towards where we would get a by name list. But there's still quite a bit of, as you noticed in Dr. Turner's slide, there's a whole process for having unique identifiers and things like that so that it's not names on the list. Mm-hmm. And we haven't worked towards that process yet. Right now it's just making sure we're matching people with the resources that are available. So, yeah, moving it forward, but not quite at the by name list.
I think all of the work is going in the same direction. So even if we're not kind of hitting those targets that we expected to, the work that you're doing is going to support this regardless. So, thank you for that.
Those are some of the, that's the silver lining to some of the things, even though we've not been able to get certain things to materialize in our community as far as specific support. There's definitely been a lot of collaboration and working on putting what everybody needs into a process, and this is just version one of an iterative thought process, and a lot that will no doubt grow and change.
Right. Okay. Go ahead, Don.
Question for Jason, if I may. Back to the consent option again that we just heard from Dr. Turner. Is that something you folks are working on right now? Do you get consent letters so that you can share information with your clients to other organizations?
Yeah, and we have for years, and I would probably say that most organizations do one way or another. Everybody might vary, and what we're going to try and do is standardize it for the community. We'll have consents, and often which agencies we may work with around somebody's care will be named out. There are some that are more blanket. I would say in the COVID scenario, part of what we're looking at, because there are limited resources for the numbers that we have, some of the pre-screen questions are you willing to engage in a coordinated support response to your needs? So at this moment, we are actually asking people up front, is this something you're interested in? Do you want to work with numerous groups that might be able to help you with whatever issues you'd like to address yourself? So that is one of the screening questions right now, is are you ready to do some of this work? And if you are, will you work with a team? So that is that's an explicit upfront question at the moment.
Thanks.
Oh, we've just had someone join us on a phone line. I'm pretty sure it's Island Health, 4251. Is that you, Lisa Murphy?
Or is it Heidi Hartman?
That looks like one of our numbers.
44251.
It does look like one of our numbers.
Yeah, that's legislative somewhere.
So someone just dialed in, 754-4251. We just need to know who they are. And you're muted, whoever you are.
I saw a little earlier, so.
Okay, we're getting a thumbs up from Ledge Services.
I don't have my number.
That's your number, Heidi?
No, it isn't. It's not. It wouldn't be a 754 number.
Oh, okay.
We would be.
Okay, we can see you, Heidi, actually. You've come up under your name. Okay, so that person may need to go into the waiting room.
Just on that the last topic, I can share, so I was involved in the creation of a wellness center for youth, and information sharing was a challenge that it came up in every single meeting, and eventually what we did was we just went super low technology, and the person who did the screening of the youth said, okay, there's a social worker on staff, there's a physician on staff, there's a public health nurse, there's name it. And is it okay if at the end of today, if I deem it necessary for your care to chat with one of these people, is that okay? And then it would be color coded of this youth consents to having a physician look at their file, or this youth consents to having the drug and alcohol counselor look at their file. And I don't know where it is now, that was years ago, but this probably doesn't need to be as big as we think it does. And I'm just saying that there's potential. I think we just need to start somewhere. And often those roadblocks that we think are going to be in our way, we can get rid of them if we just start. That's been my perspective from my experience.
Could I ask if it's possible, Jason, for those who have given consent on your list, and I don't know the number, that they could be the starting point for coordination? Just much like the example Alina gave us. So if it's 5 people, it's 5 people, and then you build on that. But you at least start building that capacity and agreement.
I'm not quite sure what you mean, if you don't mind clarifying.
Like if you have on your by name list 10 out of 100 that you've got on the list who say, yes, we want this information shared with other organizations, that we can use those 10 as a starting point, working whether it's with Ministry of Social Development, SNAMO, BC Housing, that we can start at least with that portion of your list. And then maybe we can look at ways to support you across agencies in building the list.
Well, I think we are working in that direction, but there is still to do a proper by name list. There's probably things that need to be put into place first, but this is a working group of numerous agencies that are sharing and coordinating that information. So I think it will grow in that direction, but I don't think setting it up and calling it the by name list, yes, is the right thing to do, but we are moving in that direction.
Okay. Any other points of discussion? Oh, go ahead. Sorry.
Could we just admit these individuals and ask if there's a new phone number?
Sure. Yeah. Okay, we have new people joining us. Phone number ending in 8200. Could you tell us your name, please?
Oh, maybe it's me again. Different number shows up. Lisa Murphy for Island Health.
Thanks, Lisa. Okay, anyone else? Are we good?
I would like to just check with this person and try again.
Okay, and for the second time, 754-4251. Who's attached to that number?
That's me.
Who's me?
Front end.
Oh, hi, Farnaz. Okay.
Sorry, guys. I put it on mute because I'm like ruffling. I'm like looking through the pages and don't want to make any sounds, and I forgot to unmute myself to be like 438 is me. So my apologies.
Thanks for joining us. For those who haven't met Farnaz, she's our communications manager here at the city.
Bet you won't forget me now.
Well, you could never forget you, Farnaz. Okay, so we're going to go back to 5A because we changed the order of the agenda to accommodate Dr. Turner. So we have a report from the Canadian Medical Association Foundation COVID-19 Community Response Fund for Vulnerable Populations. Lisa.
Okay, so I'll introduce, and I will be relying on Karen Constable, who wrote this report, back up here. So across Canada, there was, through the Federation of Canadian Municipalities, there was a generous gift given by an entity called the Canadian Medical Association Foundation. And they provided us with notice, I believe it was last Friday, we had a fairly quick turnaround here, that the City of Nanaimo, as one of the recipients of Reaching Home Funds, was going to get a gift of $45,000 towards vulnerable populations with COVID. So I'll let Karen provide us a few more details on that and what we're recommending in the report, if that.
Sure. So this is funding that is being allocated to only the designated communities under the Federal Reaching Home program, and the $45,000 is sort of our piece of the pie. It was a $10 million foundation gift. So we do have to let them know that we're willing to receive the gift. So this is a recommendation by the council to both receive the gift and also a recommendation on what to do with the funding. We are recommending that there's already some additional Reaching Home. We get the regular Reaching Home money.
Can I just pause? Signy Madden may need to exit the room. I don't know at what point, because it does, the recommendation does involve the United Way.
Oh, yeah. Good point.
So, sorry about that, Signy. Karen, is this the stage at which Signy should exit, or can she stay during this part of the discussion?
Is there a conflict?
There is,
That's just
because we're recommending,
Yeah.
so should she exit now or during the discussion?
She should exit now.
Okay, so Signy, you're going to be put in the waiting room. Sorry about that, guys.
Waiting room.
The corner. That's right.
Put your hat on.
Yeah, I'll be brief. The $45,000 is our piece of the pie. It's being held for us, but we need to let them know that we're willing to receive the funds. And our recommendation is that it be transferred to the United Way for distribution as grants along with the other additional COVID funding. You'll find on page 8 of your agenda, page 3 of your report, a little chart showing how the 2 pots of funding that's come in for additional COVID Reaching Home money is being allocated. There's 2 funds. One is the economic response, the other one is a smaller emergency response fund. So the idea would be to supplement those funds. Discussion United Way, because the funding round, which closes on the 15th of June, isn't complete, they don't know where the demand is going to be. They said as long as there could be some flexibility, then they could top up whatever fund is oversubscribed. In discussions with the FCM, they say that would be a fine way to distribute the funding, but we would have to report back and indicate how it was spent. Attachment A of the report is what came to us with the notification that we were eligible, or what the scheduled eligible activities, which are significant and quite similar to those that the Reaching Home funding is eligible for, so we thought it was a good fit.
And would you like to speak, Karen? We've also provided the task force with an option 2. So again, we're looking for direction from the task force that would make a recommendation to council. So option 2 provides another alternative consideration for how this funding is used. And Karen, if you'd like to give us
Sure. I mean, basically it would be keeping the money with the city. It was notable that the CMAF decided to transfer it to the cities who are designated and not to the community entities such as United Way to allow cities that flexibility. So if we did happen to get a request or have a project that council thought would really help vulnerable populations you didn't have another funding source for, some examples could include providing some sort of laundry service or additional hygiene facilities. There are some things we know we'd like to pay for, but we don't have any funding pot for, and are not covered under the EMBC emergency measures. So that's another option. There's lots of ways to spend money, as we all know.
Okay, so 2 options. Personally, I'm thinking that we have an organization that already has the administrative capability of administering these funds. The parameters are very similar, but there is something very compelling about this group having some ownership over dollars when we're in the middle of a process that could come with recommendations with a price tag. Well, not could, they will. But we're going to have a price tag at the end of this, and having some funds available to us would be beneficial. However, these are tied to COVID. So that's complicated. So does anyone have any strong feelings either way? I mean, the money's coming into the community and it's going to be spent on this, so that's good. Don, go ahead.
I would just like to move option 1.
Thank you. I can't second because I'm the chair. Does anyone else feel that option 1 is the best bet? That's where we...
You can second it.
Oh, okay, I can second it. Okay, I'll second that then for discussion. It's not very often we have $45 without anything attached to it, guys. 45,000. We can get creative. Go ahead, Don.
You can't get creative with $45.
You can't in my house.
I'll speak in favor of the motion. The reason being is that I've, having worked with United Way before in the past, this is something they've done on a regular basis. A number of organizations have asked them to funnel that they have grant money but they wanted to utilize the administration and expertise of the United Way in order to have it distributed. And I'm quite confident that they can do a very good job of this, and the reporting is in fact would be exactly what we're looking for. Thank you.
Any other thoughts? Okay, let's vote. All those in favor of giving 45,000. Jason, do you want to say something? You just came on screen. Or John? Oh no, you're just going to show hands. Okay, all those in favor.
Just say it.
Lisa, McAfee, okay. Cam, do we see your hand in favor? I'm sorry, you're very dark.
Oh, yeah, no, I can't vote, I'm non-voting.
Oh, right, thank you for that. That's why I'm not the chair. Heidi, thumbs up. Lisa?
And I'm thumbs up, it's Lisa.
Okay, wonderful. I think that is everyone who can vote. Emmy? Okay, thumbs up. Sorry, some of you are in the shade there.
We can just ask if anyone's opposed.
Is anyone opposed? For the record? Oh, unanimous decisions. Nicely done, guys. Okay, we're readmitting Signe. Okay.
We can let her know the outcome.
Can we, Karen, can we share that information?
Yeah, you can let her know, and then, of course, it's still going to move on to council for formal approval, but certainly she can know.
Okay, so Signe, I'm happy to report that we've just sent the Canadian Medical Association funding of $45,000.
We haven't met yet.
Yes, sorry, to council recommend, thank you. Again, why I'm not the chair. But we have a recommendation going forward to council that it goes to the United Way. Signe, you look like are you trying to say something? Turn on your mic. Nope. Okay, so on to Task Force Communications, agenda number E. Now, we don't have any report here, but Lisa's going to introduce us and guide us through this conversation.
So this topic is because it's come up several times, either in this forum or in others, about what's the role of the task force in communicating its work, what's the role of the coalition. There's been conversations around transparency around negotiations with BC Housing and Island Health, and all these three communication topics have been sometimes muddled and overlapped, and thought it would be good to get some clarity on what the task force wants to communicate out to the community. You know, as staff, we have done things like put things on websites. Design Labs obviously have landed because we got a good sign up for them, so people were hearing about the work of the task force through that. And as Alina's work comes, the results start coming in, and also as we start trying to get the remainder of the Design Labs rebooked, we'll have to do press releases and promotion of that information. And then, so is there, I think perhaps, is there any discussion about that and how the task force expectations, I guess, around how we're communicating to the wider community?
It's Lisa. I have a quick question. Communicating out that timely
question for me, because we met with some advocates yesterday who asked to meet with some of our outreach leads, and they wondered how do they communicate back in without peer involvement on this group. I can say more about that when it's appropriate, but just wondering if there's any opportunity to look at the communicating in and communicating out.
And so again, I guess this comes back to the role of the coalition and also the CAT team as an entity, and how they are welcome to bring things forward. And if you as Island Health are one of the representatives on the CAT team, again, you're able to bring that connection in, and people can come in as delegations. We have actually said that previously. One of our challenges right now is due to technology. In previous times, people could at least listen in or come and attend and sit, and they could if they wanted to sign up to present. This is not part of the challenge is this isn't a committee that's structured in the same way as the CAT team, that doesn't have like a voting member or in terms of reference.
Right.
Same with the coalition, nor is it like the working groups on food security or health and shelter, right? And the other groups led by Island Health. We have a very different structure here. I don't know if somebody else would like to speak, maybe I'll turn to the chairs. So I think there's some different understandings of how the groups work and how council committees operate and how they're appointed. And that's something that definitely has even come up as recently as today with one of our peers. So you have the ability as Island Health to bring forward people who would like to speak. You have the ability to bring forward messaging. And also with the CAT team, if Island Health is pretty much the lead on that, bring forward the voice of peers in the conversation. And then we did also talk about working groups as well. That's what the design labs and dialogues were for. We didn't get as far as planning the one with peers, and there were several others, so those still have to occur. I don't think, Karen, we've got a timeline yet on them. We were deliberating about the challenges of Zooming versus in person.
Yeah, there's actually several peer engagements that were postponed. There's one led by Spark BC as well, which we're hoping to use some of their resources to leverage Alina's team and possibly collaborate. But so there's lots of things that are possible. We just have to sort of see how COVID plays out before we make that absolute decision that we're going to just do it virtually, because we know, especially with vulnerable populations, that's not always the best way to connect.
Okay, so I'll just ask one quick question and then I'll stop. If a population identifying themselves as vulnerable wanted to make a presentation to this group, it's particularly around the social disorder response team and water on Wesley Street, I could be the conduit for them coming here.
Yeah.
Is that what I'm hearing?
You could. The social disorder response team isn't something that's specifically the role of the task force creation. It's council. Yeah, that's more of a council-led piece. And Lisa, I'm not sure if you were at the meeting last week when we had Dave LaBerge explain what that was, and then yesterday the CAT team, I also spoke to the misunderstanding about what that cleanup and sanitation team was, and clarifying that the terminology was being misinterpreted in terms of the intent of a team of basically our sanitation and street cleaning and parks cleaning, around needle pickup, human waste, those types of things. So
yeah, and I'm not advocating either way. I just said I would bring their request forward. There are people approached us wondering how do they put voice to the impact of that team on a vulnerable population. So I'm just looking for where that would best come. I'm certainly not leading their conversation at all.
Lisa, I think that delegation would most appropriately come to council, and we can offline help you figure out how to do that. It's just a simple delegation request. Yeah, thanks.
Okay, thank you. Yeah. That's exactly what I I needed, thank you.
And I think, in terms of clarification to and communication, is this group is very much on the strategic research end, and at the same time, the city still continues to make decisions around, opening toilets and making portables available and different things with COVID response as part of our overall emergency response in business. And it's not, this task force is very much at the kind of the strategic level. It's connected for sure. But I think, I don't know if that helps provide some clarification. If we go back to the terms of reference of what we're trying to do.
Karen?
So just in terms, because we're in COVID right now, we have not got a strategy yet on how to deal with delegations that are not agenda topics at the council meeting. So right now, there's a moratorium on that. Having said that, recommendations coming out of this particular committee or task force is that move their way up to council. At that point, it does become an agenda item. And at that point, council can entertain delegations because that portion is open. So I just wanted to offer that
So we
little.
can make a recommendation.
Yeah.
Okay.
Okay, so Lisa, I'm not sure if you caught that, but that's just going to need to be timed accordingly to make sure that it aligns with our policies and receiving delegations, but we can figure that out offline.
Okay, yeah, I'll just need help with that. That's outside my, anything I know about, so thank you.
Yeah.
Okay, on the topic of internal, external, any kind of communication?
And I guess another piece is we have a really good relationship with United Way, who on behalf of the Homelessness Coalition, we've been supporting and funding their communications, and they've been instrumental in helping promote the help seekers uptake. They've also been profiling different agencies that provide services to, as part of that spectrum of support. And then they're also, Signe, maybe you'd like to speak to some of the work that you're doing with the funding that we provide, and then Spark BC funding, how that communications work is, and where we might see that fitting, or where that is fitting, actually, let's put it that way. Signe, I think you're muted. Jessica, you might have to unblock her phone.
We're trying,
So
Signe.
Bill O'Donnell.
Yeah.
Yeah. So, there we go.
Okay, we have you, Signe.
Oh, okay, thanks. You can hear me?
Yes.
Okay. Yeah, just thanks, Lisa, and just to clarify, the coalition is receiving, I think, $50,000 from the city this year, and double that from Spark BC. And then, of course, United Way is putting their own resources into this communications work to support the coalition. And so there was a communications strategy developed with those who attend the coalition, participate in the coalition. And I mean, Lisa covered, I think, some of the activities. Obviously, we've done communications around the point-in-time counts, pre, post, what the numbers are, and sharing that, and manage the media relations on the pit count piece for the coalition. And then been doing the promotion on health seekers, doing that communications work to get more uptake on the nonprofits actually using and implementing or connecting with health seekers. And then we've had a website page linked to the United Way, and actually we're about to launch a standalone Nanaimo Homeless Coalition website. And so that has all the content about, it talks about when our meetings are, the various research that's been done, pit count, activities on connects it with the task force, and the information on the city website around the task force. And then we'll be running a month-long digital and print campaign with Nanaimo News Now. They've signed on to that once we launch the new website. And then there's a newsletter that's going to be, I think it's monthly, is what the agreement was. Jason and the co-chairs, I think they request that we do a monthly newsletter from the coalition side around what's happening in the city around homelessness and what's happening at the task force and from the coalition side. So that launches in July. And then, of course, all along we've been doing social media and blog posts about whatever's happening from the important for people to realize. The Homeless Coalition is not a standalone agency with a nonprofit status. It exists virtually in essence, and its role is a coordination body. The only funding that formally goes through the Homeless Coalition is the Reaching Home dollars, designated and Indigenous. And so the coalition has a role to set a community plan, multiple-year community plan around those Reaching Home dollars and investing those and making those decisions through an allocations committee. So the funding for communication has always come from externally, not because the coalition has no funding. It's supported by United Way because we manage the Reaching Home dollars. So I'm just emphasizing that because formally the coalition can speak about the Reaching Home dollars because it has the mandate to invest those dollars and can speak about that. Otherwise, any other communication work, we have depended on the grace and buy-in from all of the other agencies, the city, Island Health, BC Housing, to share their information and for the coalition communication strategy to be populated with relevant and current information to share out with the community. So I think one of the things that people should be aware of is there's a communication strategy developed. It was pre-COVID, and the expectation was there was going to be some announcements about new housing and other developments in the community in 2020, and that a lot of the communication strategy was around supporting those announcements, having a voice that came from the community, both from the likes of United Way donors and donors and supporters of all the agencies who sit on the coalition, as well as the coalition as itself. With COVID coming along, and then also no new announcements, particularly around homeless, housing or moving people off the street into permanent housing, the focus has really been for the last 3 months around what agencies are open, who's still delivering services, communicating that out consistently, talking about the pit count, because we were one of the only communities across Canada that actually got our pit count done just before COVID hit. So I guess what I'm sharing is the coalition, through the Reaching Home Fund, has a mandate and communicates that consistently. But I think we need to work on what is the intersection between the other funded agencies and other developments that are going to serve our homeless population, get them off the streets. And if we don't have communication protocols or can't support that, we're often behind the something gets announced in the public, and you've got a member of the task force and the coalition, in that case Kim from the chamber, going, if I'm not privy to information prior to announcements, I don't look effective to my constituents and that I represent on both the task force and the coalition. So I'm not, and when I'm pointing that out, it isn't about, we've made mistakes in the past. I think it's about opportunity and what's our vision. Because if post-task force, there's going to be funding for a coordination body that's going to do, manage and drive the coordinated access and all of that, which we're researching and developing. Where does that fit? Some communities it sits within the municipality, sometimes the municipality and others fund a separate organization. We've got a coalition, but right now it's not funded permanently to coordinate all of these, the communications work, other than if people agree to share and have an agreement to, co-craft messaging and develop that messaging. And we managed to do that with the city, working with Fernandez and obviously working with Karen and Lisa. And I think now we're at that juncture, through the coalition and that communications work, do we want to have more formal agreements with other organizations and how we are conveying, what are the solutions and how we're supporting those solutions. Sorry if it took too much time.
No, Signe, thank you for that. So a couple thoughts. My sense of communication is that the involving everyone in what kind of those announcements. We know hands are tied, we cannot say anything in advance, and I regret that Kim felt like he was put in that position, but there's no process or protocol that we could do differently around that. Regarding community communication, I think the task force could really come out swinging, for lack of a better term, and have some community conversations with residents around what does it look like to have supportive housing in your neighborhood, like connecting with our neighborhood associations, and is there an opportunity here for the work that is going on in the coalition to tap into what we hope are going to be changes to the landscape coming soon, and having those, can the task force play a role in having those preemptive conversations? Not in any specific neighborhood, obviously, but just as a general community conversation about homelessness and supportive housing. And I'm wondering if the coalition, I recognize you have the mandate, but is there an opportunity to kind of blend the communication roles of the task force, which currently sits at news releases and internal communication and website updates, but we know could benefit from a broader community push, and what the coalition is doing with their newsletter, et cetera, et cetera. So that would be my question. I would regret each independent group doing their own communications when we're all kind of thinking and saying often the same things. Anybody else? Lisa, do you want to jump in?
Yeah, I guess our hope is that the coalition can start work anytime on just helping us build that community awareness and understanding. Sometimes it's not always going to be agreement on why we have people who are struggling with what's the background to why people end up unsheltered. And that can start at any point in time. And it's needed throughout our whole community to support not only specific projects, but in neighborhoods, but also other work that council is doing, whether it's supporting social planning grants. There's a whole host of other things that we do that helps, and the work that's going out, like profiling the different organizations that if they weren't in our communities, many community members don't know what CMHA does, or the John Howard, or Salvation Army. They don't understand the full scope. So even that work that you've been doing for the past few months is very helpful. The question is whether people who are interested are the ones listening versus those who are not picking that up when it's promoted out on social media.
So it was with the city that we developed the communication strategy, and then we revisited it again. So I guess the question is, and then that's what's driving, the communication tactic that we've got in terms of creating a brand for the coalition and a website, doing the social media posts, and doing press releases, and that. So I guess the question is it a desire of the task force and the city to sit down again and revisit the communication strategy with Jason and Yvonne, the co-chairs of the coalition, and our comms folks to revisit that and say, let's redirect the efforts into something else, put the website development on hold, and, so I guess that's the question is,
So
are we reviewing the strategy again and rewriting it for the third time, or are we, and that's okay, but I think it's one of those questions, is it, if it's about community engagement with and community meetings and that, are we waiting to restart what's part of the coalition and the task force work around with Dr. Turner? Is that in that next round of community consultation pieces, is that going to address that? Come and have your say around issues around homelessness and revisiting those
community engagement pieces that we still have left under her contract? Or, you know, should we sit down with Island Health, BC Housing, you know, Lisa McCabe, the City United Way, and look at this common strategy and go, how can we shift it? And what, if we can't get advance notice of things, how can we build a better relationship, or not a better relationship, but actually build a relationship across these main funders who, you know, are doing the most work in the communities or will be making these announcements, and Cam as well from the RCMP, to revisit that communication strategy so that they're buying into it as well and providing information and informing it.
Signe, I think the strategy is fine, like proceed with website, proceed with getting that information out to the community. That is what we were hoping when we were funding, I think last year, I don't know how much we funded from this year. Yeah, 30 to 40,000 this year, 15, is that's what we were needing the support with. The other piece is, you know, I don't know if Heidi and Lisa have both spoken to this from the provincial end, and that is those negotiations that involve sites or individuals. We have agreements to honor the confidentiality of those. And that's a separate conversation. I think we've been pretty clear on that one, that those are tricky in-camera conversations for council members. I'm not sure we're going to move forward on that one. I mean, that's ultimately council's prerogative, but in terms of that draft engagement strategy that your comms and Farnaz have worked on, I'd say there's nothing stopping you or stopping the United Way from proceeding with that. That still stands quite clearly. I know we're trying to wrap 3 things into one, but that's, I don't know if anybody else who's seen that engagement strategy that we worked on. And through that, the work of the task force can be boosted and bumped through that, right? You've helped us with the design lab promotion, we put it out ourselves. So all of those things the coalition has boosted, whether it's the work by Violent Crisis Care and others, and then us with this work is also another part of that. And that fits with that engagement strategy.
And can I add to the chair? I just want to make clear also, just so everybody's understanding, that if in the future, because based on our past experience with BC Housing, if in the future we make joint announcements on site, those parties, BC Housing and the city, would be working on specific communications around those sites at that time. So I think, stepping back to reinforce what Lisa's saying, the benefit is to have the broader pre-engagement before those specific sites are ever announced, and there's you know, people want to focus on the details of that site. We've missed the opportunity for the broader engagement, and I think that's what I'd always thought this opportunity that we have right now was for.
Okay. Anyone else?
It's Heidi from BC Housing. If I could just reiterate, and I don't always want to go back to what's working in other communities, but I know how the great work of the coalition in many of our communities, and certainly in Victoria, they aren't privy to discussions about, you know, prior to announcements, but we certainly use them as, you know, in terms of rezoning opportunities, them being a really effective voice in those meetings, doing that education, doing that knowledge sharing, and I know that that's really beneficial as we move forward with housing opportunities, but just very aware that despite them being funded through the CRD and with reaching home funding, that they don't receive any additional advance information ahead of any provincial announcements, but they're still a very valued partner, and none of us could do the work we do in moving forward affordable or supportive housing without them on side.
Thanks for that, Heidi. Any other thoughts? Okay. Well, folks, that's the end of our agenda. Does anyone have anything that they want to raise? Agenda items for next time? Okay, quiet bunch. Thank you all for attending. Really appreciate your time. Take care. We need a motion to adjourn. Dawn, thank you. John, thank you. All those in favor? Everyone. Thanks, guys. Oh, Dawn, what's up?